Let me ask you a question. Does your day start or end with pain? Maybe you have an old injury or an old sports injury or bone-on-bone knee pain or a shoulder that doesn't raise up as high as you want it to, or maybe even pins and needles on the bottoms of your feet. I recently had a knee injury and realized that my age caught up with me. And to add insult to injury, you can't even get a good night's sleep so that your body can actually repair itself. Does that sound all too familiar? Well, what if I was to share with you a little known secret that could potentially eliminate all your chronic aches and pains? Unfortunately, the facts that most doctors don't want you to know about this non-surgical approach with no downtime. This cutting-edge advanced therapy is called regenerative medicine, and it utilizes natural, non-fetal stem cells. Just imagine being able to walk your dog again, or hang out with your grandkids, or play golf again. How about just getting a good 8 hours of sleep at night? Well, today we're talking with an expert in the field of regenerative medicine. His name is Dr. Michael Grego. Welcome, Dr. Grego.
Well, thank you, Joy. Thank you for having me on.
So, you are a naturopath and a chiropractor.
That's right. And we also utilize medical doctors and nutritionists in our clinic. That's because we're more integrated, so we take the best of both worlds, traditional medicine and now the more advanced natural cures that are available today.
So that's a great question, because most people don't actually know what stem cells are. So could you explain?
What stem cells? Sure. Stem cells are undifferentiated cells, meaning they don't have a specific job or function yet, and therefore they can go in and, again, look to the damaged part of the body and then make it whole again and make it new again so they can do what it's supposed to do.
So we have them on our own, in our own body, why can't we just use the ones that we have?
Well, because we're not 19 again. We're not 19 again. So basically what happens as we get older, Joy, basically when we hit 40, we reduce our stem cell count, studies have shown, up to 50% less than what we normally had. Right.
That makes a lot of sense.
Sure.
Old car.
Yeah, right. Old car. Absolutely.
So where do we actually get them?
Okay, we get them from several places, and I would like to go over a few of them if I could.
Of course.
All right. The first place, and what we use our stems or get our stem cells from, is called Wharton's jelly. And Wharton's jelly, has anybody ever tried to cut through an umbilical cord?
I have from my godson, yes.
That's right. And could you just slice right through it like a hot knife through butter?
No, it was like tough, like well-done steak.
Exactly. So that well-done steak is what's called scaffolding, and that scaffolding contains Wharton's jelly. And so Wharton's jelly is where we get our stem cells. And the second way someone can get a stem cell is quite popular, but it is lacking in some respects, and I'll go over that in just a moment. Basically, you can go into a person's vein and you can pull out PRP, what's called platelet-rich plasma. And that means they pull out your blood and they spin it. Separate the platelets, they go to the bottom, and the stem cells go to the top in plasma, or what's called a liquid gold.
Okay.
Is the slang term in the field. And so that's another way. And then another way is actually through fat cells or adipose tissue. And when they take it out of the adipose, they culture it, spin it down. Now these two methods that I just mentioned, unfortunately, they only have 15 to 20,000 stem cells. Now that sounds like a lot of stem cells, but in reality, when you compare it with Wharton's jelly, which has 800,000 stem cells, you begin to see that there's really no comparison.
That's a huge difference.
It is a huge difference, isn't it? And there's a couple more I'd like to mention if I could.
Sure, of course.
If anyone's ever worked in a wood shop or anything, then they know what an auger is. Okay, an auger is a special type of drill bit. It actually goes into wood, or in this case, the front of your hip, and it takes out a chunk of bone. And in that chunk of bone, there are stem cells. Again, they would take the stem cells out of the bone, and then you have about 15 or 20,000 of those as well. And finally, there's a way called placenta, right, where you can actually extract stem cells from placenta. The challenge there is that, well, the placenta contains blood or hemopoietic cells, and though you might not match those red blood cells or those cells that are coming out, so there might be a reaction, right, an adverse reaction. So ours can't contain any red blood cells, so therefore we don't run that risk of reactions.
Dr. Grego, we'll be right back after this quick commercial from our sponsors.
Who am I here with?
Etherine Allen.
That's right. And Miss Etherine, you had something going on.
Yes. Really, I really didn't know until I was recommended to come out here, and I found it's a solution to my pains.
Okay, but what was we talking about? What were we talking about?
My back.
Your back
And my legs.
and your legs
And my feet.
and your feet.
Mm-hmm.
And then we talked about maybe some neuropathy.
Yes.
Okay. How long has it been going on?
For years.
What?
For years.
Okay. And what have you done to try and help yourself during those years?
Taking epidural shots, and they weren't doing me no good.
Well, you're no good.
Right.
And so every year you get a little bit,
Worse and worse.
and that's not a good outcome. That's not a happy life.
Nah.
Okay.
The pain was messing with my mind.
It make you depressed.
Yes.
Can't sleep.
That's true.
Okay. So then you came here,
I came here,
and we did
fix me up.
fix you up.
Yes, and I feel good.
How good?
How good?
That's right.
So good I can do a whole day.
Thank you.
Yay!
Miss Ethelyn, I guess I can't say
Yes,
anything.
Lord, thank you.
Thank
I
you,
can
Miss.
do my whole days.
83 years old.
Want to tell everybody about your feet?
Yes, they've been swollen. I can't walk on them. They're very, very painful. I was in a wheelchair. My son told me about his program about neuropathy. And I thought, well, I'm going to try it because I've been in severe pain for many, many years. I want to show you what I can do.
So if you're suffering from shoulder, hip, knee, or foot pain, why not give Dr. Grego a call?
So call 1-800-491-1714 for your chance to attend the free stem cell seminar near you.
You've heard everyone so far. You've also heard Dr. Grego's own personal testimony. The only question now is, what are you waiting for? Isn't this what you've been looking for? Doesn't it sound like something you might need? And when you attend the seminar and go forward, how much better are you going to feel? I don't know, but I bet it would be fun to find out.
So call 1-800-491-1714 for your chance to attend the free stem cell seminar near you. 1-800-491-1714 for your chance to attend the free stem cell seminar near you.
Okay, Joy. So Miss Chantel has a question for Dr. Mike.
How does your stem cell therapy help patients?
Well, first of all, we have to understand that our bodies are constantly wearing out. For example, Joy, if you look at your fingernails, are those the same fingernails from last year, or are they brand new?
Brand new.
And the hair on your head?
Brand new.
Our stomach cells on the inside only last 5 minutes and they have to be replaced. Our hyaline cartilage in the knees, for example, takes 4 to 8 weeks in order for them to be replaced. But if the body cannot make new cells that work, that's when we get chronic pain. And so enter the stem cells. These are new cells that work for the cells that can't work. And that's how the body would use stem cells and get over pain from the inside. So in other words, we're not covering things up, we're actually fixing the body from the inside out. Does that make sense?
It makes all the sense in the world. Wow, that's a great question.
Thanks, Joy. We're here at the Atlanta airport, and I'm here with Mr. Don. How are you, Mr. Don?
Hey, I'm fine. How are you doing?
You great?
Hey, Dr. Mike. Just curious what treatments are available because I don't like taking even over-the-counter medications for inflammations or pain. I don't like them, never have. So what can I do?
If you want to cover up the pain, but what we do with stem cells is actually fix the pain. Let me rephrase that. You're not allowed to be on non-steroidal anti-inflammatories, which fall under Tylenol and Bayer aspirin and BC powder, because what happens is that actually kills the stem cells and the growth factors that try to keep the stem cell alive and going. So therefore, none of our patients are allowed to be on any non-steroidal anti-inflammatories for at least 4 weeks. They cannot be on them for at least 4 weeks.
Wow. Well, that's great, because essentially what you're doing with the stem cells will keep them from using Tylenol and aspirin.
Absolutely, isn't that the point? We don't want to mask something, we actually want to fix it.
Fix it, exactly.
Absolutely.
So what about neuropathy?
Sure, wow. Well, neuropathy, as most people know, especially those that have neuropathy, they know that there's no cure. And so every year they're actually slated to get worse. And it actually strikes home with me because my mother actually had neuropathy as a result of what's called an off-pump coronary artery bypass surgery.
Oh, wow.
I know that's a lot of words, but basically that means they took out arteries in her leg to help her heart, which was necessary, right? It's a good thing. But in the process, that gave her neuropathy, peripheral neuropathy in her feet. And she had even ulcerations. She ended up in a wheelchair. And so through a large part of the stem cells, she was able to get out of the wheelchair and she no longer needs it. And she has life back as a result.
Oh, wow.
Yes.
Oh, so she can chase after the grandkids.
That's right. So there is help for neuropathy. I guess that's the point, to let people know that in fact there are ways to help neuropathy, and stem cells are a very vital part of that. Absolutely.
Oh man, that's amazing, and it's definitely information that I know that people need to hear. So what about arthritis or bone on bone? My mom suffers from rheumatoid arthritis.
Ah,
so
yes.
what about that?
Sure. Well, basically, again, as long as there's fibers left in the joint, whether it's in the hands, the knees, the hips, the feet, if there's fibers left, and 9 times out of 10 there are, then the stem cells can go in and do their job by copying them, make more of them, and make the joint back to where it used to be.
So I know you mentioned large parts, hands, feet, knees, shoulders. Is that the only areas that you can help?
Well, it's the only areas that we do in the clinic are
Okay.
large joint injections, but there are intravenous IV stem cell usage where people use it for MS and Parkinson's and all those types of situations. We do not do that in our clinic, though.
Understood. So why don't people know more about this?
Well, it's relatively new therapies, and it is very safe, though. I have to say that the FDA comes into the labs that we use and they clear them, they make sure that they are clean and they're sanitary and everything is the way that's supposed to be. And so when we use stem cells, we use them very effectively, very safely, and we make sure that there are minimal to no reactions. In fact, Joy, we go so far as to use something called arnica in the office. And arnica, people might know, is a homeopathic remedy for bruising. And if you put it on before you do a procedure, then the bruising is actually zero.
Oh,
there is no bruising associated with it at all.
And is this a procedure that you can schedule in the morning and you're out in the afternoon?
Absolutely. There is absolutely no downtime. So people worry about, can I get back to work later on in the afternoon? Absolutely. Absolutely.
Oh man,
yes.
that's amazing. So if you're suffering from shoulder, hip, knee, or foot pain, why not give Dr. Grego a call?
I'm 83 years old.
Want to tell everybody about your feet?
Yes, they've been swollen. I can't walk on them. They're very, very painful. I was in a wheelchair. My son told me about his program about neuropathy. And I thought, well, I'm going to try it because I've been in severe pain for many, many years. I want to show you what I can do.
My back, my leg,
And your legs.
and my feet.
And then we talked about maybe some neuropathy.
Yes,
How long has it been going on?
for years.
What have you done to try and help yourself during those years?
Taking epidural shots, and they weren't doing me no good.
Every year you get a little bit.
Worse and worse. The pain was messing more with my mind.
Yeah.
I came here,
And we did.
fix me up, and I feel good.
How good?
How good?
That's right.
So good I can do a whole day. Yay!
Hello, my name is Dr. Mike Grego. I want to welcome you to our stem cell clinic. This is where we use a stem cell or regenerative medicine therapies. And Sai, thanks so much for
Thank
stopping
you.
by.
Absolutely. I am excited to learn about stem cells because I know nothing about it, but I'm
Sure.
very curious.
Absolutely. Well, stem cells are undifferentiated cells, meaning they don't have a specific job or function to do yet. And so when our bodies wear out and we're looking for new cells, if they don't work, then the stem cells come in and do the work for the cells that are no longer working, i.e. if we have knee pain, something like bone on bone, that will come in and regenerate the tissue, the cartilage, and get the knees working again.
So this could possibly avoid surgery.
Absolutely.
Okay.
I would definitely encourage people, before you get some dangerous surgeries or risky surgeries, that you look into something like stem cell therapy.
Well, so if I become a patient and let's say I do have knee pain, how often should a patient come in?
For the stem cell injection?
Yeah, for stem cells.
Well, actually, there's only one injection needed.
One?
One injection.
That's it,
right? And it's done the same day. There's no downtime. A person can come in the morning, go back to work by the afternoons, no problem at all. Yeah, it's true. And the stem cell, that one injection will actually keep regenerating itself up to 9 months. It'll keep regenerating and doubling and duplicating so they can make more stem cells so they can do deeper healing for you.
Wow, so somebody could have just that one shot and continue on.
Absolutely. Absolutely.
Oh my goodness.
That's all they need, one.
It's like a miracle shot.
We call it one and done.
You've heard everyone so far. You've also heard Dr. Grego's own personal testimony. The only question now is, what are you waiting for? Isn't this what you've been looking for? Doesn't it sound like something you might need? And when you attend the seminar and go forward, how much better are you going to feel? So call 1-800-491-1714, 1-800-491-1714 for your chance to attend the free stem cell seminar near you.
Show us around, Doc.
We'll put this, I'll tell you what, we'll just keep one, right, just lean back. There you go. On the shoulder right there. Like, lean it back all the way. Put your back against it. Yeah, just lean back all the way against it. There you go. And now, keep that there. And again, so now we have the PMF against the back of the shoulder. And what happens here is, again, if that shoulder's frozen, partially frozen, I can't lift it all the way, or it cricks or cracks and creaks. This gets rid of the cricking, the cracking, and able to get the range of motion back into the shoulder. And again, because the magnetic pulse goes right through the shoulder, regenerating the disc, anything that's healing, that's worn out in there, such as the labrum, such as the capsule in the shoulder, the labrum in the shoulder, the rotator cuff muscles that are weakened will become stronger as a result of the PMF therapy. Go back in this a little bit. Okay. Nice.
We're going to use our legs, or what we're going to
Yeah, we'll use the legs. Her legs look good. Put her legs on tape.
All right, cool.
Sit down.
Absolutely.
Okay.
Have a seat.
All right, cross them.
Actually, you can lay back just a little.
Okay, push back.
Well, this is nice and comfortable.
Okay, so size coming on here, our patient, and basically when we have neuropathy, right, we would put one on the bottom or the side of the leg, which is the lateral femoral cutaneous nerve. Anybody care? And the very center of the bottom of her foot right here, you're going to notice that happens to be another very powerful acupuncture
Man, I
point
should have
called
put more lotion on.
K1. K1 or kidney 1. It runs all the way up the body. And so what we're doing is stimulating nerve growth electrochemically. That's one of the fascinating things about this particular machine from Germany. It works both electrically and chemically. It's the only one, to my knowledge, only electroceutical machine that does both. The gentleman, the scientist that created this particular machine, name is Dr. Hans Jürgens. He was the first creator of the very first electroceutical that helped the human being back in 1967, the machine called interferential. He's 97 years old today, still putting these machines together by hand with his 3 sons in Germany, and they're second to none as far as quality, advancement, and technologies. There's nothing greater than this particular machine.
So, doctor, a patient would come into your practice for what reason?
With this neuropathy, foot pain, knee pain,
Got it.
elbow pain,
Got it.
carpal tunnel pain, frozen shoulder pain. Yes, because anyone that needs some rebuilding with the vasculature or the blood vessels or the nerves, this is the machine.
Will I be able to feel anything?
Oh yeah.
Oh really?
Oh yes, you will. This machine goes up to 100. You're going to tell her to stop at around 10. So if people need more, it's got more. I mean, this is a very heavy-duty class 1 electroceutical device that is, again, parallel. It doesn't have a parallel.
And how often would a patient have to come in, let's say if it's an ongoing
Sure.
symptoms that they've been
Patient
having?
would come in average 3 times a week
Okay.
to rebuild. Again, this is not a maintenance type situation that you're talking
Got
about.
it.
We're rebuilding.
Got it.
It's therapy. This is therapy. Okay, so you see setting this, initially we set this machine for 4,000 frequency. What that does, it takes out all the swelling and the inflammation in the body. After a week, we turn it over to the building part, which is 0.1 hertz to 100 hertz. It goes in increments all the way up to 100, then all the way back 199, 98, 97, 96, all the way back down to 0.1. And it does that repetitively through a course of about 16 minutes. That's all that we require on this particular
feel
machine.
that?
I feel it.
Is it too much?
No, it feels like my feet are asleep.
That's like your fingers.
Like, you know what, when
Yeah.
your foot falls asleep?
I need to put more lips on mine.
Oh, yeah. Oh, man. It tickles. That's what it does.
Okay, awesome. All right, so she's going to hook this up, and then we're going to turn on this this whole thing. It's because the whole experience. There's 3 generators in this pad, and they're timed with the binaural beats that are going to be coming out. These, look, we turn this on the side. You see, those are acupuncture points around the ear, stimulated again by photons of light. Yeah. We're state of the art here, baby. This is second to none technology right here. What y'all talking about? Okay, so we're gonna put these on a little size head. No, they're too big for side. No, it's okay, side. You don't like it. It is too big. You have a little head. Okay, but look straight ahead and actually close your eyes. Eyes are closed. We should show this when this goes on though. Before we show the blue lights that come out here.
Okay, on the inside of that.
Right,
Okay.
right. So when she turns that on,
Okay.
just dream the, the one we always use on music only, with the
Oh, it's got music too.
So I'll be listening to
music. But underneath that music will be offsetting beats, binaural beats that will in sync or entrain the brain to a particular frequency. Like this frequency she's doing now is around 10,000. We're going to see some blue lights coming on top in the headpiece. Okay.
Oh, I see.
Oh, you see? So they should be coming up, and we can actually turn them up a little bit. So,
I see it.
well, what I can do is, watch, if Sai will let me not bite my finger. Okay, so see, we turn them up. You got them right there, and then when we put them on a little size head, close your eyes. There you go. Now the little face is going to be lighting up with little blue lights. In fact, let's cut that so we can see blue on there. And so her brain's being entrained to this theta frequency, this calm, peace, relaxing, healing frequency. That's what we're looking for the body to do, because all healing only happens in parasympathetic mode, which is rest and digest mode. Unfortunately, the world today is geared towards stress and any financial, physical, mental, emotional, eating things that we are not supposed to eat, but we don't have any time to cook properly. So all these things manifest in what's called fight or flight. And the body, unfortunately, is unable to heal at any kind of deeper level when it's stuck in fight or flight. All right, so here we have the patient set up on what's called spinal decompression. The reason why we would decompress a spine is simply because the nerves are stenotic, they're compressed, they're subluxated, they're pinched. There's a number of ways you can articulate that. But in either case, if we need to open up that nerve hole, or if there's a disc that is herniated or bulging, then we need to get that disc back into the central part of itself. And by that I mean, if he had a bulging disc, then what happens is you need a negative pressure inside the disc. So there's more pressure outside, pushing that disc material that has bulged back inside, kind of like a jelly donut. If you put your hand on top and the bottom of a jelly donut and you squeezed it, but what if you pulled the bottom and pulled the top up? It would literally suck that jelly back in. So that's what's happening here, right, with the decompression. And so when we talk about L5, for example, the lowest one in his back goes down to his feet. So if he had some kind of foot pain or numbness or neuropathy, then we would open up that nerve so there's no longer pressure going down there. Or again, if there was a knee pain, we go up a little bit higher in the lumbars, or hip pain, even a little bit higher. And so anything that would need to be opened up neurologically. This is what we use: the spinal decompression, foot pain, knee pain, neuropathy, disc bulge, things of that nature. Would you like to drive a brand new car, or would you like a car that had 60, 70, or 80,000 miles on it already?
Do I have a car note?
No car note. The point is,
Then I'll take the brand new car.
of course, right? So what's the point? Some people might be 40, 50, 60, 70 years old, and that's how many miles they're starting when they build their stem cells, coming from those other methods that I mentioned.
And then you also said that the very first one, which was the Wharton's jelly,
correct,
that one also has the most in count, correct?
800,000, that's correct. So again, you could look at stem cells, Joy, kind of like a copy machine. And so whatever they touch, they copy. And the more copies you have, right, the bigger picture, the more complete, the more substantial change you could make in a body.
Especially if you're dealing with bone-on-bone knee injuries or sports injuries.
Absolutely. And I'm glad you brought that up, because bone-on-bone, a lot of times people think, and patients come in the office, well, I have bone-on-bone, doc, I don't think there's anything you can do for me. Well, the reality is that you still have fibers left in the bone that have the cartilage, the remains of the cartilage. And so as long as there's fibers there, we can regrow them, we can regenerate them, and potentially get that joint back to normal again, to where they're doing the golfing and they're taking their kids out fishing and hunting and going shopping and all the things that make life worthwhile.
Dr. Grego, that was a lot of information for us to take in. We'll be right back after this quick commercial for our sponsors.
So, Dr. Grego, if I actually wanted to schedule an appointment for my mom, would we be able to schedule it that day and she
Absolutely. The procedure takes 15-20 minutes, and it's only a single procedure. The stem cell itself actually keeps doubling and regenerating for up to 9 months. And so there is no downtime. Your mom could absolutely go back to work the same day as the procedure.
Well, luckily she ain't gonna go back to work, but
well, good for her.
But that is good for people that do have to go back to work.
Absolutely.
Because there are plenty of people who have suffered from many types of, injuries, and
they wonder, how long is this going to take, and is this going to hurt? It doesn't hurt. There's only one procedure done, and it works again up to 9 months, and then the long-lasting results are forever. Okay, the results last forever.
So it's a one-time thing.
Absolutely.
My legs.
And your legs.
And my feet.
And then we talked about maybe some neuropathy.
Yes.
How long has it been going on?
For years.
What have you done to try and help yourself during those years?
Taking epidural shots, and they weren't doing me no good.
And every year you get a little bit
worse and worse. The pain was messing more with my mind. I came here.
And we did.
Fix me up, and I feel good.
How good?
How good?
That's right.
So good I can do the whole day. Yay!
So if you're suffering from shoulder, hip, knee, or foot pain, why not give Dr. Grego a call?
Call 1-800-491-1714 for your chance to attend the free stem cell seminar near you. No surgery, no downtime. Cutting edge therapy. This is regenerative medicine that could potentially get you off the sidelines of life and back in the game. Dr. Grego has free stem cell seminars throughout the Auburn and Columbus area, and there are a number of options for you to choose from. Call now for free registration. 1-800-491-1714 for your chance to attend the free stem cell seminar near you.